Hello everyone, I'm Soumya. Welcome to a new episode on decoding mental health. Today we have Dr. Lakshmi Sanjay, mental health coach, psychiatrist. Thank you, doctor, for joining us today. Today we are going to discuss very important topic on autism. As a general audience, we know there is something related to communication issues or something related to creativity aspects and things like that. According to you, doctor, what is autism? Like, which age we try to analyze autism, and what are the various factors that can, give the aspects in autism?
Thanks, Soumya. I'm very happy to be here. Autism is a neurodevelopmental disorder, and the common features of autism are social communication deficits, repetitive behaviors, and communication in general may be affected in some of them. There are other features other than the classical features of autism. Classical features of autism are not very troublesome for anybody with autism. There are other features which are going to impair their functioning. This is what will trouble their daily living. So, the other features which we have to look into when it comes to autism are anxiety,
Okay.
depression,
Okay.
behavioral issues like irritability, aggressive behavior, sleep issues. These are the features which are going to disrupt their functioning. And for parents and individuals who take care of autistic individuals, these features are more troubling
Okay.
than the actual features of autism.
Okay, doctor. Thank you so much. Doctor, you mentioned about anxiety, and will it be different from different age groups, or is it like under 5 or under 10 or above 15 years of age? Will the anxiety level differs, or what are the conditions when associated with anxiety and autism?
Anxiety in neurotypical individuals is usually excessive worry and fear.
Okay.
But in autism, individuals with autism, you can see presentations of anxiety in different ways. It
Okay.
is uh, it is different for different individuals, especially in children when they are non-verbal, like they are not
Mm-hmm.
able to communicate their feelings and emotions. Then the presentation may be in terms of behavioral issues
Okay.
like screaming, avoiding, and certain times they will present aggressive. These are all features of anxiety in children with autism.
Okay.
When it comes to adults with autism also, certain behavioral issues they can present with behavioral issues like irritability and increased repetitive behaviors, which is a feature of autism. So these are the features of anxiety in autism in general, and the presentation differs for each
Okay.
individual.
Thank you, ma'am. Uh, Now, I would like to understand when a parent identify their kid is coming under the spectrum or autism, what are the main key steps they need to follow?
Identification of autism that includes assessment. First of all, they have to approach a certified psychologist or psychiatrist to first identify the level of severity in their child, and whether there are other behavioral issues, other problematic behaviors. What is the reason for that? All these have to be assessed. And generally, there are other difficulties like communication difficulties and academic difficulties for which there are certain other assessments which they will have to undergo. This all depends on where the child is, what is the age of the child, and what are the requirements of the child. So these assessments will help us identify what help the child needs. So first
Okay.
step is assessment,
Okay.
and after that, related therapies and everything else follows after the assessment.
Okay, ma'am. Thank you so much. Ma'am, also, we spoke about anxiety. That's going to be different from, children to children, adult to adult, and things like that. Do you think that there will be specific triggers that, increase this anxiety? And what will be the main problematic causes when they have this kind of social anxiety issues? How we can tackle them?
Yes. So, anxiety in autism, generally the common triggers we can group under certain headings. The first common one is social situations, where there
Okay.
is a new or strange situation.
Okay.
When individuals with autism have to face a strange or new situation, generally what will happen is there arises a fear or discomfort in within themselves, resulting in anxiety.
Okay.
And the second trigger will be second common trigger will be uh, overload of sensory issues. Sensory sensitivities is one problem which autistic individuals overgo go through on an everyday basis. So when there is a, for example, when there is loud noise, brighter lights, these are all common things which will trigger their anxieties. And the third one is they have a ritualistic pattern or behavior, and when there is a disturbance in this pattern, when the pattern is disturbed by any other new um, event, or if they have to challenge this pattern, they will end up having anxiety
Okay.
because they want to follow that ritual. Then comes specific phobias. Phobias like generally we all have certain fear factors. In some individuals this is uh, causing extreme fear, which is called phobia. So specific phobias also can result in anxiety. So these are the common triggering factors. And if we address these triggering factors, then the anxiety will come down.
Okay, ma'am. Thank you, ma'am. And we know maybe some of the people whom I know, they spoke about the therapies and medications and things like that. And normally, what works more, or when we start the medication, or do we require medication some point of time? How long the therapy that can help out? What all? What is your opinion around this, ma'am?
Okay. So this question is about whether autism can be treated.
Yes.
So there is no cure for autism, and it is not a condition which has to be cured.
Mhm.
So autistic individuals are capable of dealing with their life like everyone else. They don't
Okay.
need a cure. What is required is for them to achieve their fullest. We may have to deal with the other conditions which are affecting their normal functioning.
Okay.
So the understanding about this is very important. Otherwise, where and what you seek, if that itself is very confusing, then we will be going in different directions and not going in the direction which will help them actually.
Okay.
So, answering to the question that you asked, whether medications are required in autism, medications are required only in certain conditions. When autistic individuals have other psychiatric comorbidities like anxiety, depression,
Okay.
sleep issues, and behavioral issues, which are more threatening, like certain individuals may have aggression and aggressive behaviors, which will result in harm to others and harm to themselves. Only
Mm-hmm.
in these conditions, they require medications.
Okay.
And depending on how they are coping with these behaviors and emotional regulation, the medications have to be changed
Okay.
in due course of time. It is not like they have to take it for a very long
Lifelong.
period.
Okay.
When these behaviors are taken care of, then we can reduce the medication. It depends on the severity of the uh, problem that is we are addressing in this individual. And the next part of your question is about therapies.
Therapies, yes.
That is very important because approach towards autism should be holistic. Like all these areas are important. So, how much it is important to assess the individual as soon as possible, assess the child as soon as possible, and start early intervention. So, which is the first step. And following early intervention, which includes different therapies like occupational therapy, there is behavioral therapy, speech therapy. In all, in addition to this, when they have other issues, we can also try CBT cognitive behavioral therapy, and these are all tailor-made therapies which can be specific to that individual.
Okay, okay.
So these therapies should be ongoing, and as and when they don't require that support, we may withdraw them from those therapies.
Okay, ma'am. Yes, ma'am. These days we have a good number of special care institutions, special care centers for helping and supporting kids who require special needs, who has into the spectrum and things like that. And coming to the optimal minds, in optimal minds, what all help that you're offering to the people who are coming in?
In optimal minds, as we discussed in the previous question, the approach is holistic. So, starting with assessment to psychiatric evaluation, followed
Yes.
by psychological evaluation, which will result in guiding them through all these therapies, where we guide the parents as to where they have to approach for speech therapy, occupational therapy, based on the level of the child's performance and difficulties. And following that, we also have newer interventions, which include neuromodulation treatment modalities, which have now come a long way in helping individuals with autism. And it is not like we are treating the autism here, we are treating the behavioral issues here.
Okay.
So, and the emotional issues that autistic individuals are going through. So, there is a holistic approach that we follow in Optimal Minds, helping them in all ways possible to not waste any more time and go in the right direction.
Okay. Thinking about the maybe the treatments or maybe the therapies or maybe any solutions, what are the new ways of helping members or kids who have autism? And do you follow any new methods where we can share with our audience as well, so they can also might come and take your help in this regard?
Yes. Um, First thing, what we follow here is parents and caregivers of individuals with autism, they need more care as well. So, my advice is like not only the individual with autism, but the whole family needs to come into the picture when we take care of autism. So, where they have to be psychoeducated, what we call as educating the caregivers about the spectrum and the future of the individual planned well. So, this is like not a single step treatment measure, but it's a process.
Okay.
So, starting from that to the process where we guide them along the path. And what are the other newer strategies that we follow in this path? Will be incorporating all the therapies in one place. So, the caregiver doesn't have to be uh, going to different places and having ideas and getting exhausted end of the day. And one step that we have added to this traditional treatment measures is neuromodulation, where we provide personalized RTMS. RTMS is repetitive transcranial magnetic stimulation,
Yes.
which is also a very uh, evidence based treatment measure, which has helped in dealing with all the comorbidities that individuals with autism are suffering through. So this is like very important for the parents and the caregivers to understand that uh, where they have to incorporate all this knowledge that they have gained through all these sessions that we are providing here into their routine everyday life. Not just this doesn't end in the clinic space.
Okay.
This has to be applied in their routine, which is also supervised by us.
Ma'am, you have mentioned about RTMS and maybe PRTMS also, it is also evident. Can you just give little more idea how PRTMS gonna be beneficial, or is there any ways that for our viewers to understand, or where they can come and take your help, in this regard?
Yes. So, to understand PRTMS, I have to touch about TMS,
Mhm.
transcranial magnetic stimulation. Transcranial magnetic stimulation is nothing but we use magnetic stimulation to directly treat specific areas of the brain.
Okay.
So, TMS has been there for many, many years. And now, RTMS, repetitive transcranial magnetic stimulation, is also an evolution of TMS, where we are able to deliver magnetic stimulation to specific areas. And we have seen good results in terms of addressing anxiety, depression, and phobia,
Oh,
and repetitive behaviors in individuals with autism. So there is enough research backing to show that the efficacy of RTMS in any individual going through depression, anxiety, and behavioral issues in
okay.
autism.
Okay, ma'am.
So also the importance of knowing the improvements in cognitive abilities because of RTMS will help in the um, improvement of focus and attention in individuals with autism. Personalized neuromodulation treatment modality,
Okay.
where we use advanced tool called spectral EEG, and clinical assessment is used to guide the treatment delivered to the individuals with autism.
Okay.
So this is more advanced in the way that it is personalized to the individual.
Okay.
So it is not one treatment for everybody.
Okay.
It is tailored treatment for each individual. So the individual who's getting these benefits get that more better, and it's more time buying us more time in other therapies, and giving us more clear idea of uh, how and when their abilities are improving as we give PRTMs.
Thank you, ma'am. Thank you so much for sharing detailed aspects of autism, and our viewers and listeners also will be able to understand more about autism, like how anxiety works, what all the core comorbidities associated with autism, and what are the therapies, how it is going to help, newest developments also you have shared. Thank you everyone joining us today for the interaction with Dr. Lakshmi Sanjay, founder and director, Optimal Minds Brain Wellness Clinic. It's as we always say, it is okay to take help any point of time. Thank you for joining us, and see you for the next episode.
Thank you.